Hey, welcome to the Metabolic Motivation Show. My name is Dan O'Byrne, formerly a fatigued, flabby, and frustrated business executive who learned to use science-based lifestyle habits to reboot my metabolism so I could look better, feel better, and perform better, both at work, play, and in the bedroom. So if this sounds interesting to you, stick around, join our Facebook group, and we'll also be interviewing experts here from around the world, and we'd love to get your feedback. So without further ado, let the show begin. Okay, we're going to jump right into the Metabolic Motivation Show. Really excited to have Dr. Sarah Hallberg. She's an obesity doctor who actually gets results and lasting results, has a waiting list for her program at Indiana University where she's the director of medical weight loss. So Dr. Hallberg, good morning. Thanks for getting up really early for us today. How are you?
I'm doing great, thanks. Glad to be here.
Fantastic. Well, we're going to talk about your really interesting TED Talk that you did on reversing type 2 diabetes and more. But before we get into that, there was we were just mentioning and talking about some research that just had come out. Did you want to share anything about any new research that you've seen in the medical and nutrition literature?
Well, sure. We just finished a study that we just presented at the National Lipid Association, so I'm happy to talk about that.
Yeah.
So it was just a start. You're going to see more research coming out of our department, but this was a retrospective look at how our program, which is a low-carb, high-fat-based program, works when we compare it to a American Diabetes Association based nutrition program for patients with type 2 diabetes after a 6 months period of time. And so what we did is we took 50 patients in each group and we looked at what kind of changes occurred with them after 6 months of either program. And what we found is that hemoglobin A1C, which is a measurement of blood sugar, decreased actually in both groups.
Wow.
But here's the interesting thing. You've got a choice on how you want to decrease your blood sugar, right? You can decrease your blood sugar the way we do it, which means you take $6,000 a month almost, less medication as the group. The group took $6,000 a month less medication. Or the American Diabetes Association group increased their costs significantly. And just to take a look at insulin. So in the two groups, in our group, our patients decreased their insulin usage by almost 500 units a day.
Wow.
And the ADA group increased their insulin by 350 units a day. Not everybody was taking insulin, but it really shows that there's two different ways to approach this disease, right? And this is just a perfect example of it. Because we can approach this disease as a disease that is progressive. And this was a really big theme of my TED Talk. You know, the way the American Diabetes Association approaches is that, look, you have this diagnosis. There's nothing you can do about it. We can do things to keep it from getting worse. But again, based on just our research, I would say that's not really working that well because the way they're trying to keep it from getting worse is just to give people more drugs.
Right.
Or you can treat it with a nutrition-based approach, which means you need less medicine. And again, as in the case with our program, resolve the diabetes time and time again. So, this study was geared to look at both the metabolic indices, but also the financial ramifications of the two different approaches. And I think that's kind of unique. So the financial ramifications were there too, but the other significant findings is our patients had a significantly lower triglyceride level, not surprising to anybody who is familiar with nutrition and triglycerides with carbohydrates. Our patients also had significantly lower creatinine. So again, we see that a lot, that kidney function improves. So it was a good study, and we're currently writing it up for a full publication right now.
Wow! Congratulations on that. I'll be looking forward to seeing that and following your research. And This is wonderful stuff. While we're talking science, if I can kind of geek out just a little more here. There was sort of a landmark change in the position of what used to be the American Dietetic Association, who has maybe they were ashamed of their past and they changed their name to the American or to the Academy of Nutrition and Dietetics. Can you tell us a little bit about their change of position?
Yeah, actually, so we called this "Hell Freezing Pigs Flying News," right? Because on May 8th, and this is truly big because this is going to affect policy, but the the Academy of Nutrition and Dietetics came out and said that made a policy statement basically on the 2015 dietary guidelines. And one of the big things that they said that they disagreed with is that they think in the guidelines, saturated fat should be removed as a nutrient of concern because there's no evidence that it causes heart disease. And there's not. I mean, most people presume that evidence exists, but it does not. The big news is not that saturated fat doesn't cause heart disease. The big news is that we've got a policy statement about it, which is, I mean, I give them big kudos for this. And I think this is going to be a trickle down in the way that we approach nutrition. And it's going to have important impacts because our past policies, as we all know, have been a big failure.
Oh yeah, by all means. I mean, if we, so would it be fair to say if we look back at for people that haven't seen your work or maybe are new to this whole area of eating less carbs and more healthy fat, can we look at it? Could we look at a graph of the low fat guidelines that started back over 25 years ago? And if we put that graph out and then look at the obesity level, rate of obesity and rate of diabetes, would it be fair to say there's a pretty positive relationship between between those guidelines and the increase in obesity and diabetes?
Actually, I would kind of disagree with that. It's an exact increase.
Okay.
It is pretty. I mean, it's fascinating. And, you know, the argument that we get, people say, oh, a lot of things happened in the 1970s. McDonald's came out in the 1970s. Processed food started to trickle in and become a little more prevalent in the 1970s. You know, my favorite thing people blame is, I always say women went back to work in droves in the 1970s, so we could just blame the gender, right? And, you know, I don't think that most people doubt that those things all played a role. But what we have to appreciate is the push, the insistence on removing fat impacted all those significantly. And the biggest one that it impacted was the processed food. I mean, we have developed this completely perverse system of instructing people to eat fake food in an attempt to avoid fat. And it's ridiculous. I had a patient come in who had seen a dietitian somewhere else and said, actually for her daughter, she had accompanied her daughter who was obese and insulin resistant. And what the daughter had been instructed to eat was salad, grapes, and goldfish crackers.
Oof.
And I thought, goldfish crackers? Because they were low fat. So if you put salad and a goldfish cracker together for lunch, I guess you've got
and this was a professional dietitian?
Yeah. And the mother was like, I left and cried because I thought, I knew that wasn't right. And I thought, oh my gosh, you know, but again, it's an example of how we have gotten so, we can't see the forest for the trees because we're focused on avoiding fat, okay? Which first of all is wrong in the first place. But in order to do that, what we wound up introducing into our food system, which has impacted now more than one generation, is that we introduced processed, sugar-sweetened things so that the stuff without fat could taste good. And it's just been a diabolical mess. And I think right now we're just so fortunate. There's some really good names out there who are really working hard to change, you know, not only what we instruct people, but change our food system as well. And we've really got to go back to square one on this and realize, you know what, first of all, one of the biggest steps is fat is not our enemy. It is not our enemy. It is our friend. And we need to start eating it again so that we can stick with a diet based on real food.
Yeah, that's a key thing. Let's, along with that part of the part of your talk that was very impactful for me was that we should stop blaming people and stop obese people for being obese, because it's actually a metabolic condition. It's a metabolic disease based on the faulty guidelines, and maybe you can speak a little bit about that.
Oh, I'd love to, because honestly, this is one of the things that motivates me every day to get up and work really hard for this message. Because, I mean, I see this. People come in and it is amazing just the raw emotion people have. I mean, obesity is such an emotional issue, and these people have been beaten down. They have been shamed, blamed. I mean, it's horrible. And when you give them the proper instruction, what you see is they will follow it. People have said, oh, you can't do it. They won't listen. People are lazy. And I say, gosh, give them something that works. Give them something that is straightforward, that is practical. Explain the concepts to them, because one of the big basis of our programs, and it starts out from the very beginning, is I spend an hour going over nutrition science with people. Explain to them why they want to do this. Explain to them what they have been told didn't work. Explain to them it's not their fault. And you'll be surprised at the results. And this can really change people's lives. And let me tell you, that is so empowering and motivating as a practitioner. I love doing this. It's a joy to help people like this and to get them out of this vicious cycle of, just being knocked down all the time.
Yeah, it's really a false dichotomy, when we say, okay, you either do this and you're successful, or you're just a fat, lazy slob. That's kind of where most people think, the whole thing lines up. So I would throw in a little analogy as someone who's created a couple of businesses that actually worked, and then 4 or 5 that failed. There's a lot of ways to fail in weight loss, and there's a lot of things you can do wrong, even though you try really, really hard. Just like in business, there's a lot of ways to fail if you're not doing the fundamentals correctly. And so for me, one of the fundamental thing is if you're constantly putting in a lot of carbs, you're driving up your insulin level, and you're going to because you have to deal with that glucose. Now, let's talk about that a little bit. What's going on with insulin resistance?
Well, so insulin resistance is incredibly complicated. And one of the things is, we know an awful lot about insulin resistance, but we don't know the precise exact starting point. I mean, is it the liver that really begins insulin resistance? Is it the muscle? The science is not completely solid on that. But what we know is, very simply, our intake of carbohydrates drives our blood sugar. Our blood sugar is driving the need for insulin, right? And so when our blood sugar is up because we're eating all these carbs and we're having to put out more insulin, and insulin rises, we become resistant to it. And then eventually the pancreas starts to fail, right? It can't keep up with all the insulin needs. And then that's when diabetes develops. We get back to the mechanisms of insulin resistance. And one of the things that we hear about all the time is, well, gee, insulin resistance is caused by fatty acids. So stop eating fat. It does make sense. And it's like, wait a minute. Fatty acids and triglycerides increase with, hold the phone here it comes, carbs, not fat. And so, anyone preaching that, oh my goodness, it's the fat that we're eating, causing the problem with insulin resistance, because it's the fatty acids working in the muscle, working in the liver that initially start the problem. I say, wait a minute, that's actually disingenuous, because we know, people who understand nutrition, that, I mean, it's called carbohydrate-induced lipemia. That's been a term around since the 50s.
Yes.
So we know that's what causes the higher carbs. In fact, I mean, triglycerides can increase up to tenfold in someone eating high carbohydrates. And here's another, interesting bit. The thing also has to do with the triglycerides around in between meals, right? The little fat and the particles, that when we're eating high carbs, the in-between period with a high carb diet can be increased 26 times.
Wow.
So during, that postprandial period. And so it's just, again, the fatty acids have something to do with it. The question really comes, what caused them to be there, right? What increases them in the blood? It's not fat, it's the carbohydrates. And, to take this one step further, the other thing is, not only are the fatty acids increased by carbohydrates, but the saturated fatty acids in the blood are increased by carbohydrates. Again, it seems like it doesn't make sense, but that's what our studies show us.
Yeah, that's fascinating stuff. In your TED Talk, which I'd encourage everyone to check out, that you also have some really powerful stats. And I think you mentioned that near 50% of American adults are now diabetic or pre-diabetic. Now, are all of those? Is that if I have my notes correctly done here? That would be something like 120 million people.
Yeah, I mean, it's a lot of people. But again, and I point out that the other thing too is when we're talking about health repercussions, clearly if you have diabetes or pre-diabetes, I don't think that's a stretch for anybody to understand that that's impactful on your health. But the problem is that that hardly includes everyone who's having an impact from carbohydrates on their health, because one of the things that we know about type 2 diabetes is that people have had issues with elevated insulin levels, okay, which again, insulin resistance has developed long before the diagnosis of prediabetes. In fact, people have had those elevated insulin levels not just for years, but often for decades before that diagnosis is made. So the health ramifications of this and of our dietary advice have been around for a very long time in people before they actually get a true diagnosis of diabetes. Type 2 diabetes, of course. Type 1 is very different. We just need to make sure that we make mention of that.
Right. Interesting. And another effect for, a lot of people really don't know much about insulin, but insulin, as far as secondary effects, or would also would be what would be the effect of insulin on appetite and cravings?
So, this is a subject up for debate, but I talk about insulin in my TED Talk, increasing appetite. And, then people say, well, there's short-term studies that show that insulin actually decreases appetite. But I think that we're getting confused on short-term and long-term impacts of insulin. So short-term in healthy people, that's true. But what we're talking about is the long-term effects of chronically elevated insulin levels. And what we get there is we get these elevated insulin levels. We get these huge swings in our blood sugars, and people get hungry from it. And it drives cravings. I mean, we see it all the time. I mean, one of the bottom lines, the most important and simplest way to think about insulin is this. Insulin is our fat storage hormone. We can't store fat without insulin. And when we have elevated insulin levels, what are we going to store more of? Continue to store more fat. So we have to really appreciate it. It can be boiled down that simple.
And when we're talking about storing fat, are we also talking about the glucose, the circulating glucose, postprandial, that has to go somewhere, right? So it's going to go either to muscle tissue or to the fat tissue.
Right. So, here's an example. So when someone, at any given time, right now, in someone who doesn't have diabetes, if you don't have diabetes, there's actually less than a teaspoon of sugar in your blood right now, with normal blood sugar level. Less than a teaspoon is what it really turns out to be. And kind of thinking about it like teaspoons can be very easy for people to appreciate and understand. So we have less than a teaspoon of blood in our, less than a teaspoon of sugar in our blood right now if you don't have diabetes. If we eat a meal, according to the American Diabetes Association, right, that has, let's just say, 75 carbs in it, and there's 5 grams per teaspoon. All right, we're talking a meal of over 10 times what we've got in our blood, 75 to 100, well over that. And so what are we going to do with that? So we can only keep about a teaspoon of sugar in our blood. If we
so
just
that's the limit. That's not just the baseline.
That's normal. That's the limit for a normal blood sugar.
Limit. Okay, I didn't know
that's normal for a normal blood sugar. So then we intake, right, 75, 100 carbs, or if you're not following the American Diabetes Association guidelines, it's even greater because people will ingest 200 sometimes as in a meal, grams of carbohydrates.
Yeah, I used
to
do that myself.
Right, so we're ingesting this, and then the question is, all right, so where's that going, right? I mean, it has to go somewhere. The point is that if you're insulin resistant, you're having trouble getting sugar, glucose, where it needs to go into the cells. So because it can't just all float around in there all the time, right? It can't. Otherwise, we'd walk around with blood sugars of 1,000, right? If we ingest a huge meal, we can't dispose of it because we're insulin resistant. Can't get it into the cells, our blood sugars would automatically be 1,000. But that doesn't happen. What happens to it? Exactly what you just said. It gets changed into liver, in the liver, it gets changed into fat. It's called de novo lipogenesis. And that's what occurs. And again, more fat, it goes to our fat storages, but it also then increases the fatty acids and triglycerides in our blood. So it really causes a problem on 2 levels.
Right. Now, for one example I think sometimes people might relate to is if someone has an out of control level of glucose and they're insulin resistant, the body's producing, we know, more and more insulin. Is this related to some of the damaging effects of diabetes? Whether it's there's cases of I know I was talking to Dr. Gary Fettke, who's in Australia, and he was talking about, he's a surgeon and unfortunately has to deal with a lot of amputations for diabetics who have, not dealt with their diabetes, or maybe they've been trying to. Would this be, these diabetic long-term, damaging symptoms? How does that relate to the insulin and the glucose?
Well, I mean, so with diabetes, right, which of course would be the elevated glucose, we know there are multiple complications. But the interesting thing is, and going back to before you get the diabetes, well, what we know is that many people, especially with neuropathy, so neuropathy is numbness, tingling, often significant pain that develops, usually starts in the feet, called diabetic neuropathy. What we see happening is that people develop diabetic neuropathy before they get diabetes.
Right, okay.
So that can happen even before the diagnosis comes. And the reason for that is those insulin levels, the metabolic changes have been brewing for a long time. So it doesn't have to even be full out diabetes yet to be developing all these secondary problems, right? And of course, then once diabetes comes in, we really start to speed up those comorbidities, kidneys fail, blindness. I mean, there's just so many things that come along with it. If instead of waiting till someone gets this diagnosis and then racing really fast to try to keep it under control and deal with it so we don't get these complications, if we can dial it back a little bit and keep the problem from occurring before we actually have the diagnosis, it's so much easier to deal with. So and you really bring up a great point, which is, why are we waiting? Why do we wait till someone has this terrible diagnosis of diabetes? Why aren't we dealing with the nutrition and teaching people how to eat to prevent it before any of the problems come? Yeah, it's another thing that doesn't make sense.
I always tell it. My wife is wonderful at cutting through all the clutter that sometimes I can come up with mentally about trying to explain these things, and I would, trying to explain these concepts, to friends and family who are not really into science, or they just don't have time for it. And she said, it's like pouring gasoline on a fire. If you're telling a diabetic person who's carb intolerant to, it's okay to eat a high carb diet, keep your fats low, and then just take insulin. It's
right.
like, so it's like the insulin is calling the fire department. It's like, you've got your house is on fire, but you keep, you add fuel to the fire, and then you just call the fire department every day.
Right. And we put in the insulin, right, which is fat storage. And, everyone says, well, wait, when I started insulin, I gained weight. Yes, that's right. Easy to believe.
Oh, yeah, definitely. Well, I know we've got a tight schedule. You've got a busy day, and so we're going to probably wrap things up here, and we'll have to get together and have another chat down the road because you've got some fascinating material. If we were just to summarize things, if you could dial it down to 2 or 3 recommendations in really simplified, really simplified for people to get the maximum benefit from this information, what would that be?
Well, definitely, without question, the most important, I think, thing people just need to remember when it comes to our relationship with food, any human being's relationship with food, is to eat real food. That is so critical. Eat real food. And then the second one is eat fat. Eat a lot of fat. And by doing that, you'll cut down on your carbohydrates. I would add a third one that says very specifically, cut down on the carbs. I think a good recommendation for pretty much everyone, is even someone who's healthy, keep those carbs, under 100 or 75 grams a day. Now, patients who have problems already, we drive those carbs much lower than that. But cut the carbs, eat a lot more fat, and your body will be a lot happier for it. You'll feel a lot better. And again, down the road, if you're still one of the people who are healthy, which, is a dwindling number, that'll keep you from having problems in the future.
Fantastic. So to summarize that, eat real food, high healthy fat, and less carbs.
Yeah. And can I just make a quick note on that healthy fat business? Because I get this question all the time, so it'd be a good place to address it is, what is a healthy fat? And it's a great question, actually. So, the thing is, let me tell you, what we've been told is not a healthy fat is the saturated fat, right? Stay away from animal fat products, coconut oil, those kinds of things. And I would say, no, actually, those are the healthy fats. And olive oil, so our monounsaturated fats are healthy. Our omega-3 fats are very healthy. And, what we want to stay away from 100% is the trans fats. We can say blanket statements. That is an unhealthy fat. There's no question about it. And then I think we need to be very cautious about our intake of the omega-6s. We need to be careful about our consumption of refined vegetable-based oils. But the rest of the fats are healthy fats.
Excellent. Great information. So, Dr. Sarah Hallberg, thank you so much for coming on the show today. I hope you have a wonderful day there, and with all the stuff you're doing. And for people that want to find you or want to check out your program, I think you actually have a waiting list. But for anyone that might want to find out more, what's the best place to find you? I know you have a really cool website that is at fitteru.us. Is that correct?
Yeah, and you can link into the TED Talk if anybody's interested just through that website. That's probably the best place.
Excellent. Great. Well, keep up the good work, and we will stay in contact on Twitter and social media and all that, and talk to you later.
Have a good day. Thanks so much.
You too. Take care. Bye-bye.
Bye-bye.
Hey, before you go, 3 quick things. First, if you like this video, please share it. Second, if you'd like to empower yourself on a regular basis, check out all the free information we have over at metabolicmotivation.com. And thirdly, if you'd like to fast track your own progress so you can look better, feel better, and perform better, we are now offering free 15-minute phone consults to answer your biggest question. And all you have to do is go to metabolicmotivation.com and just click on the Contact Us button. So that's all for now. Thanks again, and talk to you soon.